Understanding and dealing with chemicals, particularly in the workplace, is something America's healthcare professionals have been doing for years. Some 32 million workers are potentially exposed to hazardous chemicals on the job each year. Chemical exposure can cause and contribute to a number of serious health problems, including cancer, heart ailments, damage to the central nervous system, kidneys and lungs, burns and rashes, and sterility. Some chemicals may also be safety hazards and can cause fires and explosions and other serious accidents. In order to protect workers from the potentially harmful effects of hazardous chemicals, OSHA, the Occupational Safety and Health Administration, issued the Hazard Communications Standard. This standard requires that the hazards of all chemicals and drugs imported into, produced, or used in the U.S. are evaluated, and that this hazard information is passed on to affected employers and exposed employees. A safety officer must be appointed to manage the Hazard Communication Program. In large practices with 50 or more workers, a safety committee of 3 to 5 people may be used to assist the safety officer. Who is covered by the standard? All personnel, including part-time and temporary employees involved in any aspect of handling hazardous chemicals or drugs. Examples include physicians, nurses, housekeepers, and employees involved in receiving, transport, or storage. Office workers who encounter hazardous chemicals and drugs only in isolated circumstances are not covered by the rule. The Hazard Communication Standard was recently revised to include the globally harmonized system, which ensures quality and consistency of labeling by using pictograms, signal words, and hazard and precautionary statements. Manufacturers are required to revise Material Safety Data Sheets, MSDS, into Safety Data Sheets, SDS, that have a standardized format, and convert all chemical container labels into the new labeling system by June 2015. Because some manufacturers may revise the SDSs and labels prior to June 2015, facilities must provide awareness training on the pictograms, new labeling system, and format of new safety data sheets, as required by OSHA, for all workers, so that when the new labels with pictograms arrive in the workplace, everyone will understand what they mean. A key requirement for compliance with Hazard Communication Standard is the availability of safety data sheets for each hazardous chemical. SDSs provide comprehensive information that can be used for risk management of the chemical in the workplace. Safety data sheets will have a 16-section standardized format. SDSs will contain essentially the same information as the MSDS, but with specific headings in a specific order. The GHS update enhances but does not replace the Hazard Communication Standard elements that have not changed and are still required. These include having a written hazard communication plan, providing personal protective equipment or PPE, spill kits, and training to employees on signs and symptoms of exposure, protocols for reporting exposure, and reviewing the plan annually. Compliance with the standard involves creating a written hazard communication plan that outlines how employee information will be distributed and how training will be accomplished. The standard describes the requirements for labels and other forms of warning, such as MSDSs, Material Safety Data Sheets, or SDS. Here is how a facility creates a hazard communication program. The chemical and drug manufacturers and importers must evaluate the hazards for each chemical or drug they produce or import. Using that information, they must then prepare labels for containers and the MSDS or SDS. Using the labels and MSDS or SDS provided by chemical and drug manufacturers, employers must develop, implement, and maintain a comprehensive written hazard communication program. The employer must identify and list hazardous chemicals in the workplace, obtain the MSDS or SDS and labels for each hazardous chemical and drug, communicate hazard information to their employees through labels, MSDS or SDS, and formal training programs, provide appropriate personal protective equipment or PPE, such as gloves, goggles, and aprons, to protect employees from exposure, provide medical services and first aid where the eyes or body may be exposed to injurious corrosive materials. Make this written hazard communication program available to employees. To begin the program, the safety officer must make a list of all hazardous chemicals and drugs in the facility. The list may be compiled for the workplace as a whole or for individual work areas, depending on the size of the facility. The responsibility for determining whether a chemical or drug is hazardous lies with the manufacturer or importer of the product. You may rely on the evaluation received from these suppliers through labels on containers and safety data sheets. The best way to prepare a comprehensive list is to write down the names of chemicals and drugs in your facility that have a label indicating a potential hazard. A chemical is considered hazardous if it is labeled as flammable, explosive, eye irritant, requires well-ventilated area, carcinogenic, corrosive, sensitizing, and list potential health effects. For example, glutaraldehyde or OPA, orthophthalealdehyde, is considered hazardous because it is labeled as harmful to the lungs and is an eye irritant and sensitizer. The Hazard Communication Standard covers chemicals in all physical forms: liquids, solids, gases, vapors, fumes, and mists, regardless of whether they are contained. Think about substances generated in the work operations, such as vapors or dust, as these may be covered too. The Hazard Communication Standard applies to pharmaceuticals that the drug manufacturers have determined to be hazardous and that are known to be present in the workplace in such a manner that employees may be exposed under normal conditions of use. This includes drugs that are not in final pill form and may present a hazard in an emergency or as a result of an accidental spill. Hazardous drugs are defined as those that could cause genotoxicity, which results in damage to DNA, and may cause mutation or cancer. Teratogenicity, capable of causing fertility impairment or fetus malformation. Serious organ damage or other toxic manifestations at low doses in experimental animals or treated patients. Examples of common drugs considered hazardous are ribavirin, vincristine, fluorouracil, mitomycin, tamoxifen, methotrexate. A hazardous chemical list is used to record each hazardous chemical and drug found in your facility, the chemical name and brand name, the target organs affected by the chemical or drug, the personal protective equipment to be used when handling the chemical or drug, what it's used for, the manufacturer's name, address, and phone number. Check to see whether an MSDS or SDS is on file for each hazardous chemical and drug in the facility. Purchasing records may help you identify hazardous products in your facility. Chemicals and drugs that are labeled as health hazards may cause measurable changes in the body, such as decreased pulmonary function. These changes are generally indicated by signs and symptoms in the exposed employees. Employees are considered to be potentially exposed if they are subjected to a hazardous chemical or drug in the course of employment through any route of entry, such as inhalation, skin contact, ingestion, or absorption. Employees exposed to such hazards must be aware of the change in body function the chemical may cause and the signs and symptoms that may signal that change. Here are the target organs that hazardous chemicals and drugs may affect. Hepatotoxins, chemicals or drugs which produce liver damage. Signs and symptoms: jaundice, liver enlargement. Nephrotoxins, chemicals or drugs which produce kidney damage. Signs and symptoms: edema, proteinuria. Neurotoxins, chemicals which produce their primary toxic effects on the nervous system, such as the brain and spinal cord. Signs and symptoms: narcosis, behavioral changes, decrease in motor functions. Mercury and lead are examples of neurotoxins. Agents which act on the blood or hematopoietic system decrease hemoglobin function, depriving the body tissues of oxygen. Signs and symptoms: cyanosis, loss of consciousness. Agents which damage the lungs, chemicals which irritate or damage pulmonary tissue. Signs and symptoms: cough, tightness in the chest, shortness of breath. Reproductive toxins, chemicals which affect the reproductive capabilities, including chromosomal damage and effects on fetuses. Signs and symptoms: birth defects, sterility. Cytotoxic drugs are examples of reproductive toxins. Cutaneous hazards, chemicals which affect the dermal layer of the body. Signs and symptoms: defatting of the skin, rashes, irritation. Eye hazards, chemicals which affect the eye or visual capacity. Signs and symptoms: conjunctivitis, corneal damage. Ethylene oxide, a commonly used sterilant, is an example of an eye hazard. Potential signs and symptoms of occupational overexposure for a specific chemical or drug can also be found on the MSDS or SDS. Each container must be clearly labeled, tagged, or marked with the identity of the hazardous chemical it contains, along with a hazard warning appropriate for employee protection. Labels must be legible in English and prominently displayed. The hazard warning must contain a pictogram for each hazard class, signal word, warning or danger, and precautionary statements, as well as the supplier's or manufacturer's contact information. This is a bottle of glutaraldehyde. If it is poured into another container for use, a label must be prepared for that container. The label information must include the brand name, the chemical name and strength, and the dilution of the substance, if any, along with the name, address, and emergency phone number of the manufacturer. Under the GHS update, the pictogram, hazard statements, signal words, and precautionary statements need to be included. In-house labeling systems have included a hazard warning and include target organs affected. In this case, it's lungs and eyes. This label includes additional information on personal protective equipment because goggles, a face mask, a gown, and chemical-resistant gloves must be worn when pouring, stirring, or mixing the product. When labeling containers, don't write directly onto the container. Use a label like this one, and then cover the label with a clear, waterproof tape to prevent the writing from smearing. For materials that are not in their original container, a legible photocopy of the original label is acceptable. If the hazardous chemical is intended for immediate use by the employee who transfers into a portable container, the portable container does not have to be labeled. Household products such as window cleaner and whiteout are not considered hazardous as long as they are used in a manner and quantity that the manufacturer intended for the product. While products like bleach and drain cleaner may be purchased in a grocery store, they may be used differently in a healthcare setting than in a household. An SDS would be needed for identification of PPE to be worn when using the product, as well as first aid and emergency response if there is an accidental spill or splash. Hazardous drugs must have specific label information that can be easily read by the employee. This is the label for vincristine sulfate injection. It is considered hazardous because it is labeled as a teratogen. Once your survey of hazardous chemicals and drugs is complete, make sure that every container of hazardous material is properly labeled and that you have an SDS for each item on your list. If not, order an SDS from the supplier, manufacturer, or importer and document that you have requested the SDS. This list of hazardous chemicals and drugs will serve as an inventory that should be updated as new chemicals and hazardous drugs are purchased. As new SDSs are received, they should be given to the safety officer or other designated person responsible for obtaining and maintaining SDS. When a chemical or drug is no longer used at the facility, you might want to remove its name from the list and place the SDS in a file to be retained for 30 years per the OSHA standard. Safety data sheets describe the hazardous chemicals' physical and chemical properties, physical hazards such as flammability, health hazards such as irritation, lung damage, and cancer, routes of exposure and exposure limits, precautions for safe handling and use, emergency and first aid procedures, spill, leak, and disposal procedures. Each SDS must be in English. Section 1 lists identifying information, including the name of the chemical or product, the chemical manufacturer or supplier including address and contact information, and recommended use and restrictions on use. Section 2 details all hazards, regardless of the concentration, and required label elements, including pictograms. Section 3 provides information on chemical ingredients. Section 4 lists first aid measures, including signs and symptoms, and acute and delayed effects. It also details required treatment, including the use of an eye wash station. Section 5 covers firefighting measures, including suitable and unsuitable extinguishing media, precautions, and specific hazards arising from products of combustion. Section 6 lists accident release measures, including emergency response precautions and personal protective equipment needed. It also lists procedures for the cleanup of spills or leaks. Section 7 provides handling and storage information, including precautions for safe handling, storage, and use, including incompatibilities. Section 8 covers exposure controls and personal protection, including regulatory exposure limits, use of personal protective equipment, work practice controls, and ventilation requirements to minimize exposures. Section 9 lists physical and chemical properties such as vapor pressure, specific gravity, color, odor, pH, appearance, and physical hazards of the chemical such as flammability and explosive limits. Section 10 details the stability and reactivity of the chemical, including risks of explosion of the product in presence of static discharge or impact, incompatible materials, and conditions to avoid. Section 11 includes toxicological information, such as routes of exposure, symptoms, delayed and immediate effects, listing as to whether the chemical is toxic, a carcinogen, or reproductive hazard, including the OSHA permissible exposure level, any limits recommended by the manufacturer, NIOSH, ACGIH, IARC, NTP, and ASDTR. Section 12 provides ecological information, such as environmental impacts if known. Section 13 covers disposal considerations, including how to handle, manage, and dispose of the chemical waste. Section 14 is transport information, such as shipping and labeling requirements. Section 15 covers regulatory information, such as product-specific safety, health, and environmental regulations. And Section 16 includes other information, such as date of preparation or last revision. Employees are not expected to memorize information in the MSDS/SDS, but they are expected to know where to look to find critical information, such as the hazards associated with the product, the signs and symptoms of occupational overexposure, and the proper PPE to use when handling the product. Copies of the MSDS/SDS for hazardous chemicals in the facility must be readily available to employees during each work shift. Most employers keep the MSDS/SDS in a binder in a central location, and others computerize the information and provide access through terminals. As long as employees can get the information when they need it, either approach may be used. The employees must have access to the MSDS/SDS themselves. When a container of hazardous chemical is received, make sure that it has been properly labeled. Your suppliers are required to send you a properly completed MSDS at the time of the first shipment of a new chemical. If the supplier forgets to send an MSDS or provides you with an MSDS that is obviously inadequate with, for example, blank spaces that are not completed, request an appropriately completed one and document the request. If your request goes unanswered, contact your local OSHA office for assistance in obtaining the MSDS. The safety officer must make employees aware of the dangers of hazardous chemicals and drugs before handling them. Employees must be trained at the beginning of their employment, before their assignment to an area, or when they are reassigned, when a new hazardous material is introduced into their workplace, and when safe handling and emergency procedures are modified. OSHA does not require employers to maintain records for employee training, but many employers do in order to monitor their own program to ensure that all employees have received appropriate training. Periodically train employees to understand procedures and to correctly follow policies, such as procedures in place that provide for isolation of the contaminated area. Have spill kits available to help clean up small spills of 25 milliliters or less. When the MSDS or SDS says that the eye should be flushed if the chemical splashes into an employee's eyes, an eye wash station is required for corrosive or caustic chemicals. The SDS will indicate if the facility is required to have an eye wash station available and in place so that the worker can reach it within 10 seconds. The flow must remain on for 15 minutes without the use of hands. The unit should be located on the same floor as the hazard, and the path of travel should not be obstructed, often interpreted as through no closed doors. Each eye wash location should be identified with a highly visible sign. The area around the eye wash should be well lighted. Maintain the eye wash according to the manufacturer's instructions. Plumbed units should be activated weekly to verify operation. All units should be inspected annually. Every worker dealing with hazardous chemicals should know where the eye wash station is located and how to operate it correctly. A medical record created in connection with a hazardous chemical exposure or a drug exposure should be kept for the duration of employment, plus 30 years. Many states have their own regulations, which could be more stringent than those of OSHA. Your safety officer can contact the appropriate agency to learn of any additional requirements. Employees have a need and a right to know the hazards of chemicals and drugs they work with. How to read labels and safety data sheets. The proper personal protective equipment to wear when working with a hazardous chemical or drug. How to properly dispose of hazardous PPE. how to handle a leak or spill, how to be prepared to handle an employee exposure situation. The GHS update will provide a mechanism for employees the right to understand information about the hazardous chemicals in their workplace. The advantages of these revisions to the way hazardous chemicals are labeled include the following. They will reduce confusion about hazard classifications, increase understanding about safety precautions to take, approved use, proper storage and disposal of chemicals and mixtures, increase downstream risk management by increasing understanding of the risks of hazardous chemicals, facilitate training with uniform safety data sheets and well-defined hazard classes, enhance worker understanding, especially for low literacy workers and those workers where English is a second language. By June 2015, the Hazard Communication Standard will require pictograms on labels to alert users of the chemical hazards to which they may be exposed. The pictogram on the label is determined by the chemical hazard classification. Each pictogram consists of a symbol on a white background framed within a red border and represents a distinct hazard or hazards. In the GHS system, a hazard rating of 1 indicates the most severe hazard. These pictograms will replace the use of other in-house rating systems. Until the pictograms and new labels are fully in place, either your in-house system or the new labeling system is acceptable to OSHA until June 2015. Workers need to be able to recognize both systems if both systems are used in a facility. The following common pictograms will be found in healthcare: health hazards, carcinogens, mutagens, flame, flammable, exclamation point, sensitizers and irritants, compressed gases, corrosives, flame over circle, oxidizers, skull and crossbones, acutely toxic. The new labeling system requires a product identifier name to match the information on the SDS. A pictogram for each hazard class must be a red-bordered diamond with black image. A signal word, danger or warning. Danger identifies imminent hazard resulting in death or severe injury. Warning identifies hazard with potential for injury or death. The labels also require hazard statements that consist of standardized phrases assigned to each hazard class, such as may cause dizziness, respiratory irritant, or may cause kidney damage. Other requirements include precautionary statements that describe ways to prevent or minimize adverse effects, such as prevention, PPE, ventilation requirements, response for fire, accidental spills, exposure, and first aid, storage, for example, tightly covered inflammable cabinet, disposal, local, state, federal regulations. The label should also have the name, address, and telephone number of supplier or manufacturer. Methods for labeling secondary containers include the following: copy and affix original label, or use a National Fire Protection Association (NFPA) diamond-shaped label with these: red equals fire, yellow equals reactive, blue equals health, white equals special. For example, corrosive, acid, alkali, no water. The label must list hazard ratings from 1 to 4, where 4 is most hazardous. Or you can attach appropriate pictograms and label information once they are available from the manufacturer. When hazardous chemicals are transferred to secondary containers, label with chemical name, ingredients. Include warning statement, danger or warning. Also, the name must match the identity, name from the SDS, and the label must include hazard statements such as causes respiratory distress, skin irritant. OSHA is allowing the use of the current Hazard Communication Standard that allows employers to use workplace-specific labeling systems like NFPA hazard diamonds as long as they provide the required information. Workplace label systems may need to be updated to make sure the information is consistent with the new classifications. Hazard communication is an ongoing program, not a one-time effort. In order to have a successful program, the safety officer must provide initial and ongoing training to employees.